Good afternoon, everyone. I'm Dr. Prasanna. Today we'll discuss about the topic known as Zika virus in pregnancy. Okay, if someone who want to plan for pregnancy or if she's already pregnant, what to do if she get Zika virus? Okay, Zika virus prevalent areas are there, like South America and all. If people go traveling to that place and they'll return, if they want to plan for pregnancy, then we'll say, okay, you should wait for some days in that way. Okay, so what is Zika virus? So Zika virus is an arbovirus. Is an arbovirus. It is transmitted by mosquito. Which mosquito? Aedes mosquito. Once the Aedes mosquito bites our body, then the virus get inside into our body and it shows the symptoms at least 3 to 14 days. Okay. Same like malaria only. All the symptoms like fever, chills, rigors, myalgia, arthralgia. More towards chikungunya symptoms. Like if you have so much of joint pains in Zika virus infection. Okay, not only that, you can have a retroorbital pain. The eyes also will become very painful. Even the retroorbital pain can be seen. Along with all this, you'll have a rash on the body with full of itching. Okay, that's about Zika virus symptoms. If a couple returned from a place like South America where Zika virus is prevalent, so return from that place, then we'll advise that couple that use contraception for at least 3 months. Okay, so anytime the male person, if he is traveling, then we should advise contraception for 3 months. If only female is traveling, then we'll advise contraception for 2 months. Okay, so if a couple is going, then couple have male also, so we'll advise contraception for 3 months. Okay, if the Zika virus has been entered inside our body, then there is a risk that there is a chance that the baby can be affected. So we'll do 18 to 20 weeks ultrasound scan where we can find some anomalies like microcephaly. You can have cerebral calcifications, okay, ventriculomegaly, this thing, okay. Now we'll see different algorithms. What should we do in some time, okay? Hmm. Give me just 1 minute. Now let's see some of the algorithms. Okay. Okay. Right. Hmm. So same thing. If a male person is traveled or not, and the partner is pregnant or not, we'll see. If the male person is traveled and partner is pregnant, then if then you'll see that the person, yes, then you'll see you use barrier methods of contraception for entire during pregnancy. Okay, because the female can get infection from the male person. That's why entire pregnancy they will use barrier contraception. Okay, if a male person travel and the female partner is not pregnant, then you will avoid contraception. As male person is being travel, we'll avoid contraception for 3 months. Okay. Now coming to second one, if there is a female traveler, if the female traveler and she's currently pregnant, yes, then we'll say again the same. If the male person also travel, then use contraception as barrier. If no male person didn't travel, only the female person travel, then 2 months at least you use contraception. If the female person travel and she is not pregnant, and you will see whether the male person is traveling or not. If the male person didn't travel, only the female person travel, then you will use 2 months of contraception. If the male person also travel, then you will use 3 months of contraception. Basic funda is if the male person or couple, when male person also traveling for 3 months, then then you should use contraception that is valid for at least 3 months. Next, yeah. See this. Return traveler concerned about Zika virus infection. If a traveler return from a place where there is Zika virus is prevalent, okay, for that person, you will see she got symptoms or not. Okay, if the symptoms are there, then has the patient recovered or not? You will see if the symptoms are not there. Is it more than 4 weeks since last exposure or not? No, we'll see. If after last exposure there is more than 4 weeks, then there is no need of any testing. Okay, or else at least we'll wait until 4 weeks for after last possible exposure. Hmm. That's not important. This is very important. See this. It's published in February 2019. Okay, so first point is pregnant woman with a history of travel during pregnancy to country or area with risk of Zika transmission. Okay, so a lady who is pregnant and she traveled to a place where there is Zika virus. Okay, first thing you'll see pregnant woman reports clinical illness consistent of Zika virus disease during or within 2 weeks of travel or sexual contact with the infectious partner. So within 2 weeks she will show symptoms. Okay, so once that person gives history of travel, then you'll ask whether she's symptomatic or not. If symptoms are there and she was resolved with the symptoms, then you submit the serum for the testing of RAPL. Okay, you'll submit the symptoms for the testing of that Zika virus. Okay, Zika virus testing. Then also send urine within 21 days of symptom onset. Once the symptoms are onset, like chills, either retroorbital pain is present, then within 21 days, that means within 3 weeks, you'll send the urine sample also. And as she's pregnant, we will offer the ultrasound screening. Okay, then hmm, then you have currently if she is symptomatic, then submit serum for testing of RAPL. You send the blood sample and also send urine within 21 days of symptom onset. You'll offer the fetal ultrasound as well. Okay, if the urine blood shows positive Zika virus PCR, then if there is positive and or antibody test results are positive, then we'll keep one more. We'll submit the further samples as advised by RAPL. And as she's already positive for Zika virus, we'll refer her for fetal medicine services. Okay, follow up will be done. If the Zika virus antibody PCR results are negative, then we'll confirm negative antibody tests on further serum samples. Okay, then your normal pregnancy care is done. If symptom resolved and we send the serum samples, now if that is positive, again we'll send her for fetal medicine department. Okay. If a pregnant woman with a history of travel during pregnancy to a country with Zika virus, then pregnant woman does not report clinical illness consistent with Zika virus disease within 2 weeks of travel, then then also if she doesn't develop any symptoms, then also you take a clotted serum sample and store. And you always offer fetal ultrasound, which at the 18 to 20 weeks at the same visit if visit is less than 20 weeks. Okay, 18 to 20 weeks generally we'll offer. If she came later weeks, then we'll offer later on the same visit. Okay, and we'll consider to repeat the ultrasound at 20 to 30 weeks. So basically, you will do ultrasound on the 18 to 20 weeks. Again, we'll repeat it 20 to 30 weeks. If abnormal findings like I told you, microcephaly is there, intracranial calcification, then you'll refer her to fetal medicine service. Okay, basic question in this is 18 to 20 weeks. You'll do a complete fetal anomaly scan. Okay. So in this, there is a question. See, a 37-year-old gravid to Paravan 2 weeks ago arrived from Dominican Republic. That means where the Zika virus is present. She has come for her first ANC visit at 20 weeks of gestation. Okay. So today she has her scan, which is normal. Also, she's coming from endemic area of Zika virus. How to follow up her? Okay. She came at 20 weeks and from a Zika virus area, and 2 weeks were already passed. So what you'll do? So send serum for seroconversion right now to RIPL, send a urine sample for detection of virus. As she's asymptomatic, no need to do anything. Reassure her. Repeat ultrasound scan at 28 to 30 weeks. So basically, She came from that area and we don't know whether she's symptomatic or not. Okay. So in that case, if symptoms are there, they will mention. As I didn't mention anything, we'll consider it as asymptomatic. And in asymptomatic, I already told that in no symptoms, no report clinical illness, then you will do ultrasound scan at 80 to 20 weeks. So answer is 18 to 20 weeks, but she already had a scan on 20 weeks, which was normal in the question. So we'll repeat the ultrasound scan at 28 to 30 weeks. Okay. See this question. A couple attends the infertility clinic for undergoing IVF. Partner gives a history of recent travel to South America. What is the advice that you give to the couple? So South America, Zika virus is prevalent. And couple travel, even the male person travel. So we postpone IVF after 3 months. Okay? Sorry. A 34-year-old immigrant woman telephones the maternity assessment unit for advice. She had returned from a business trip from an area where Zika virus transmission is known to occur. The couple has been trying for a baby and wonder if it is safe to have unprotected intercourse. Okay, so they traveled to a Zika virus area, a couple. Then what should we do? Or not a couple, the woman, only the woman traveled. Okay, so woman traveled, so we'll ask her to try for pregnancy after 2 months. So what type of virus? Revision. What type of virus is Zika virus? It's an arbovirus and its genus is flavivirus. It is spread by Aedes mosquito. Incubation period is 3 to 12 days. And female and male partner returned from a trip from somewhere suspected Zika virus infection. When to check for Zika virus infection or seroconversion? So seroconversion occurs at 4 weeks. Okay, what is seroconversion? What is seroconversion? A virus after entering into the body, it enters into the DNA. Na? So in that way, it enters into the DNA and replicates itself. That is my seroconversion. It takes about 4 weeks. What are the different newborn effects? Microcephaly, microphthalmia, cerebral interference calcification, ocular calcification, ventriculomegaly. Okay, sometimes virus can also trigger group B streptococcal infection. I think it's not group B. Virus also triggers Guillain-Barré syndrome. Okay, I think it is CNS syndrome, right? Hmm. So that's it. That's about Zika virus. I hope this is so fine about Zika virus. Whatever thing you, very important questions are about Zika virus is about that thing. If male partner or couple goes, then you should avoid pregnancy for 3 months. If female partner only goes, then avoid pregnancy for at least 2 months. And seroconversion takes about 4 weeks time. Okay. And if a pregnant female came, she went or she traveled to an area of Zika virus, then she's pregnant also. So you will see symptoms or not. If there is no symptom, nothing, then you'll go for ultrasound scan at 18 to 20 weeks. And also you'll repeat the scan at 20 to 30 weeks because there are anomalies in the baby like microcephaly, intracranial calcification, ocular calcification, ventriculomegaly, these things. Okay, if this pregnant lady traveled to that place and she's having symptoms, and you'll see whether when is the last symptom and all. In that way you'll send samples, you'll send the serum sample, and also you'll send the urine sample within 21 days of symptoms. Okay, if these samples are positive, then just you'll maintain her in a follow-up under fetal medicine department. Okay, this is about Zika virus. Next I'll tell about listeriosis. Okay, thank you, bye.